What's up, folks? I'm back, and I'm gonna keep this one short and sweet, or at least I'm gonna try. Uh, I was just exposed to a pretty interesting poll result from a survey carried out by The Economist magazine and YouGov. It turns out that these folks wanted to find out what Americans typically think about whether they benefit from government subsidized health insurance. It turns out most Americans labor under the misconception that the government does not subsidize their health care. They actually did a scientific poll of a representative sample of the population, and it turns out that most Americans, I think 84% of Americans aged 18 to 29, think that they don't benefit from government subsidies to help pay for their health care. 82% of Americans aged 30 to 44 believe that they don't get such government subsidies. 84% of Americans aged 45 to 64 and 93% of Americans over the age of 65 think that they don't get government subsidies for their health insurance. Now, ladies and gentlemen, this is completely ridiculous, as I'm sure more than a few of you know. Not only do many of these folks have absolutely no excuse for laboring under this misconception, because, for example, the 93% of Americans over the age of 65 who think they don't get government insurance or government help to get health insurance benefit from Medicare, which is America's single-payer health insurance program for the elderly. And of course, that's a direct government. So I guess it's technically, one can make the case that it's not technically a subsidy, but it certainly is government help in actually accessing health care. But the fact remains, the vast majority of Americans do in fact get government help with their access to health care. And that's because most Americans get their health insurance from their employers thanks to a major government federal tax credit that basically exempts health insurance as a benefit that employers pay to their employees from taxation. I've written on this in the past, and a lot of people who know a lot more about this subject than I do have written extensively on it. The reason why America has the basic health insurance system that it has dates back to World War II. During the war, the Roosevelt administration imposed wage and price controls on the economy as part of the U.S. war effort, and that meant that American employers couldn't compete for the best and brightest talent in the job market by offering higher wages and salaries. So they started competing for the best and brightest talent by offering health insurance and other fringe benefits, because it just so happened that those were not taxed as compensation or as pay at that time. The federal government caught on and decided to encourage that practice as a means of expanding access to health insurance to as many sectors of the American population as possible. And then later on in the 1960s, the Lyndon Johnson administration added Medicare and Medicaid to the policy mix. And so that's how America has this jumbled, convoluted healthcare system with a whole bunch of different programs to cover different slices of the population. But let's not forget that there is that massive tax subsidy, essentially, for employer-provided health insurance, and that's where most Americans get their health insurance. It's where I got my health insurance on my job here in D.C. for the past while. Also, in addition to that, you do have programs like Medicare and Medicaid. Medicaid is America's, for those who don't know, Medicaid is America's program for the poor. As I mentioned in one of my earlier videos from last fall, I actually have extensive experience with that particular program because I was on it for a year after I was attacked on the DC subway and got a bone in my face broken. And it just so happened that the insurance I had gotten through law school expired on the day that I was attacked. So I wasn't covered. And so I actually applied for Medicaid coverage while I was while I was in the hospital, and ended up getting it for a year. I didn't even think that, I was surprised to learn that I was eligible for it since I am Canadian, but it turned out that in D.C. in particular, I'm sure D.C. is not the only part of the states that has a rule that's permissive, as long as you're here legally and you can prove it and you can prove that you make below a certain income, and thus you need the help, you can get it. And so I got it. And so I have extensive experience with a number of different means of getting help with paying for your health insurance. I have experience with Canadian single-payer socialized medicine. I have experience with one of America's own single-payer health insurance, government health insurance programs, namely Medicaid, because I was unemployed at the time. And then, I was doing poorly paid internships. That's how I was able to qualify for it. And then I also have experience getting my insurance from my employer. So I've actually walked this talk myself, all within the past couple of years, and that's why it really strikes me when I see results of opinion polls like this one. I'm not that surprised that so many Americans are so tragically and horrifically misinformed about whether they get help from the government paying for their health care, but it is still dismaying. And I saw the result of this poll on an article on gov't.com, written by Matthew Iglesias, one of the better known policy wonks in the nation. And one of the things he pointed out was that Americans' ignorance on this subject makes it harder for both reformers on the left and the right to sell their reforms to the American people. The fact that so many Americans think that they pay for their insurance entirely on their own, or that they get help from their bosses but the government is not involved, actually makes it harder for reformers of all stripes, whether they're liberal, conservative, or libertarian like myself, to make their proposals politically viable. So this is the kind of misinformation that reformers of all stripes are up against, and I think it's important that we all know that. I just thought I would share that with you. And there's one last really important point that explains why I'm sharing this particular video. The reason is that there's a lot of misconceptions about American healthcare out there, not only in this country, not only among Americans, but around the world. People who both admire and support America's existing healthcare system, although I can't imagine why you would, because I think it's a convoluted, tortured mess, and people who oppose it, both in this country and elsewhere, all seem to think that America has some kind of, private sector dominated free market capitalist healthcare system. The reality is America does not have a truly free market capitalist healthcare system, and it has not had such a system for a long time. I'm sorry, but there's just way too much government involvement in the system already as it currently stands for that to be the case. And let's not try and blame Obamacare for that, as they call it, Obamacare. You've got supporters of the law calling it that now too, as well. Let's not even entertain the delusion that that law is the only reason why American healthcare is so socialized these days. It's been that way for decades. That just added one more convoluted set of laws and regulations and piled them on top of the thousands of such regulations at the federal, state, and local levels that already have been hobbling American healthcare for decades. There's one particular statistic that I hope all of you keep in mind. The last time I actually saw any statistics on this matter, which was a couple of years ago at most, 50 cents out of every dollar spent on healthcare in this country was spent by one level of government or another, whether the federal government, some state governments, or local government, right? Now, when half of the money spent on healthcare in a country is spent by some level of government, you can't really call that a free market capitalist healthcare system. I think that's important for people who are critical of American healthcare to know, as well as for people who like the system the way it is. Although, again, I think you'd be crazy to to prefer the American healthcare system in its current form. And I say that for reasons, rooted in free market theory as much as anything else. So I'm not going to go into any more detail, but let's all keep that in mind. I grew up in Canada, where there's a widespread perception that in America there's this dog-eat-dog capitalist healthcare system that lets unfortunate, uninsured people die in the streets. Actually, nothing could be further from the truth. That's not to say that the American healthcare system isn't screwed up in a lot of ways. It most certainly is. And I've never been convinced, by the way, that President Obama's healthcare law has been the right solution to that problem, but at the same time, let's not oppose or criticize that system for the wrong reasons. Let's make sure we have the right information to back up those criticisms. So that's going to be all for today. That's just one more misconception that I hope I've helped all of you clear up in your minds. And I guess we'll see where the discussion goes, if there is one. Sayonara.